diet and heart disease is clear. Certain foods can cause plaque buildup in arteries, increasing the risk of heart attack. However, research shows that a plant-based diet can reverse heart disease. The Lifestyle Heart Trial, conducted by the Cleveland Clinic, proved the benefits of a whole food, plant-based diet. Participants experienced regression of atherosclerosis and less frequent angina episodes. Switch to a plant-based diet to reduce heart disease risks, lower cholesterol and blood pressure. Opt for fresh fruits, veggies, whole grains, and skip processed foods, white rice, bread, and unhealthy fats. American Heart Association supports this heart-healthy approach, noting improved endothelial function and blood vessel health. Take charge of your heart health and lower heart disease risk with a plant-based diet. A plant-based diet, rich in fruits, vegetables, whole grains, and legumes, promotes heart health. High in fiber, it controls blood sugar levels and reduces the risk of coronary artery disease. Plant-based proteins, like beans and lentils, are heart-healthy alternatives. Nitric oxide from a plant-based diet improves endothelial function, benefiting cardiovascular health. Research shows a link between these diets and lower risk of cardiovascular disease. By adopting a plant-based diet, you can significantly lower your risk factors for heart disease. The American Heart Association recommends it as part of a healthy lifestyle to reduce heart attack risk. Embrace a plant-based way of eating for improved heart health. Consuming red meat and animal products has been linked to an increased risk of heart disease, including coronary heart disease. Processed meats, like hot dogs and sausages, should be limited as well. High intake of dairy products, especially those high in fat, has also been associated with a heightened risk of heart disease. Animal products contribute to high cholesterol levels and plaque buildup in the arteries, increasing the risk of heart attacks and other cardiovascular issues. To reduce these risks, incorporate more plant-based foods into your diet, like fruits, vegetables, whole grains, and legumes. Ideally, prioritize unprocessed or minimally processed plant-based foods. Are you considering how to transition to a plant-based diet? Start by deciding whether to switch gradually or all at once. Begin by incorporating more fruits and vegetables into your meals. Gradually reduce meat consumption and explore plant-based protein sources like tofu or tempeh. Experiment with new recipes for variety. Check out the recipes on Vegan Globetrotter for ideas and suggestions. Making the switch to a plant-based diet is a personal decision, and there are pros and cons to both gradual and immediate transitions. Gradually transitioning may be easier for some, allowing them to adjust to new flavors and lifestyle changes. Switching to a plant-based diet has immediate health benefits. It can lower cardiovascular risk by 52% over 30 years, compared to a diet high in animal products. The portfolio diet, which lowers cholesterol levels, may reduce heart disease risk by 11% over 10 years. After just 4 weeks, a plant-based diet lowers blood pressure, cholesterol, and weight while improving blood flow and endothelial function. In 3 months, it can reverse coronary artery disease by opening blocked arteries and improving blood flow. As you can see, a plant-based diet can have a significant and rapid impact on your heart health, as well as your overall well-being. Switching all at once makes these improvements more quickly with permanent results. Ultimately, it's important to consider your level of commitment and readiness for a lifestyle change when deciding which approach is best for you. If you are interested in adopting a plant-based diet, you can find some tips and resources on how to do so here. Incorporating more fruits and veggies into your diet is crucial for a plant-based lifestyle and can greatly impact heart health. Fill half your plate with these nutrient-rich foods at each meal. Try different types, whether fresh, frozen, or canned, to find your favorites and add variety to your dishes. Smoothies, salads, stir-fries, and more are perfect for including these plant-based options and boosting your nutrition. Exploring new fruits and veggies expands your palate and provides a wider range of nutrients. Join a CSA program for a consistent supply of fresh, seasonal produce. Start small and gradually increase your intake to make lasting changes and enhance your heart health. You can take several practical steps to gradually reduce meat consumption and embrace a more plant-based way of eating. Start by reducing the portion sizes of meat on your plate and increasing the amount of plant-based foods. Experiment with meatless meals a few times weekly, incorporating plant-based protein alternatives like beans, lentils, tempeh, or tofu. Try out vegetarian recipes such as veggie burgers, vegetable stir-fries, and grain salads to explore new flavors and textures. To cut down on meat consumption, try plant-based substitutes like meat products, mushrooms, or jackfruit. Gradually decrease meat intake and opt for plant-based meals. This approach offers health benefits, like lower risks of coronary artery disease and atherosclerosis regression, as proven by research from reputable institutions. 59 words. To promote heart health, include heart-healthy power foods like whole grains, fruits, vegetables, legumes, and nuts. Omega-3 fatty acids found in flax seeds, chia seeds, walnuts, and fatty fish are beneficial for the heart. Limit high-sodium foods like processed snacks, soups, and fast food as they contribute to high blood pressure. Moderation is key for foods high in added sugars, like sugary drinks, desserts, and foods with added sugars. When it comes to fats, choosing healthy options is essential. Opt for sources of healthy fats like avocados, olive oil, and nuts, as opposed to saturated and trans fats, which can increase the risk of heart disease. By including these heart-healthy foods and avoiding or limiting certain foods, you can support a healthy heart and reduce the risk factors associated with heart disease. Incorporating power foods like berries, dark leafy greens, nuts, legumes, and whole grains can boost heart health. Berries are loaded with antioxidants, while leafy greens provide essential vitamins and minerals. Nuts offer healthy fats and fiber, and legumes are rich in plant-based protein. Whole grains supply heart-healthy fiber, vitamins, minerals, and antioxidants. By adding these foods to your diet, you can improve heart health and lower heart disease risk. Be cautious of foods that harm your heart. Limit high cholesterol foods, red meat, organ meats, high-fat dairy, avoid trans fats, fried foods, snacks, baked goods, minimize highly processed foods, added sugars, unhealthy fats, refined grains, and reduce excessive salt intake, processed, packaged foods. Modify saturated fat consumption, meat, dairy, butter, or heart health. Adapt these dietary changes for a healthy heart. A vegan diet is effective in preventing and reversing heart disease by reducing the risk factors associated with it. Switching to a plant-based diet can lower cholesterol levels, improving heart health and reducing the chances of developing heart disease. Incorporate plant-based foods gradually to make the switch. Try new recipes to discover tasty alternatives. Seek guidance from a nutritionist for valuable insights. Find plant-based alternatives to meat dishes for an easier transition. Educate yourself about plant-based diets for informed choices. Lastly, empower yourself with knowledge to build a strong foundation for your new eating habits. Medical professionals recommend plant-based diets to reverse heart disease. Research shows their positive impact on heart health. The American Heart Association states that a plant-based diet can reduce the risk factors for coronary artery disease and heart attacks. Studies at respected institutions like the Cleveland Clinic and New York City show the benefits of a plant-based diet in reducing chest pain, atherosclerosis, and angina episodes. The mechanism behind the effectiveness of a plant-based diet lies in its ability to lower LDL cholesterol levels, improve blood vessel health, and promote endothelial dysfunction. You positively impact your heart health by eliminating foods high in saturated fats and cholesterol, such as unprocessed red meat, and replacing them with fresh fruits, vegetables, whole grains, and legumes. Leading experts recommend adopting a plant-based diet as a way of eating that prioritizes heart health and overall well-being. Processed meat replacements can be a part of a plant-based diet. It's a personal choice whether to include them or not. Some plant-based eaters prefer whole plant foods, while others incorporate meat alternatives. There are various options available, but they are not necessary. Processed meat replacements can aid in the transition, but whole plant foods should form the foundation. Processed meat replacement foods are foods designed to mimic the taste, texture, and appearance of meat but made from plant-based or synthetic ingredients. Some examples are veggie burgers, soy sausages, tofu bacon, and lab-grown meat. While these foods may seem like a healthier and more sustainable alternative to meat, there are some reasons to avoid them or consume them in moderation. One reason to avoid processed meat replacement foods is that they may still contain harmful additives, such as nitrates, nitrites, salt, sugar, preservatives, and artificial flavors and colors. These additives can increase the risk of cancer, diabetes, heart disease, and other chronic diseases. Processed meat replacement foods may also lose important nutrients and phytochemicals found in whole plant foods, such as fiber, antioxidants, and vitamins. One reason to avoid processed meat replacement foods is their potential environmental and ethical impact. These foods often require significant resources to produce, contributing to issues like greenhouse gas emissions, deforestation, water pollution, and soil degradation. Additionally, some alternatives involve animal testing, genetic engineering, or patenting, raising ethical concerns. Choosing whole or minimally processed plant foods like beans, lentils, nuts, seeds, grains, fruits, and vegetables is a better option, offering diverse nutrients, flavors, and health benefits. Making your own meat alternatives using simple ingredients gives you more control over your health and the environment. Plant-based diets emphasize whole, minimally processed foods, while Western diets are high in processed and animal-based foods. Plant-based diets are lower in saturated fat and cholesterol, providing necessary nutrients without relying heavily on meat for protein. Switching to a plant-based diet may reduce the risk of heart disease and other chronic illnesses associated with a Western diet. Incorporating fruits, vegetables, whole grains, legumes, nuts, and seeds into a plant-based diet is highly recommended. Leafy greens like spinach and kale provide essential nutrients such as calcium and iron. Soy products like tofu and tempeh can serve as excellent protein sources. Additionally, berries and other antioxidant-rich fruits help reduce inflammation in the body. Processed meat replacements can be included in a plant-based diet but are not recommended long-term. See information above. Moderation is key. Opt for foods made from whole foods with minimal processing to avoid added sugars, salt, and preservatives. Focus on incorporating whole plant-based foods for optimal heart health benefits. Yes, you can meet your protein needs with a plant-based diet. Include beans, lentils, tofu, tempeh, nuts, and seeds for a variety of plant-based protein sources. Consult a registered dietitian to ensure your nutritional needs are met on a plant-based diet. A plant-based diet can support weight loss due to its lower calorie content and higher fiber intake. However, individual results may vary based on factors like activity level, metabolism, and overall calorie consumption. It's important to consult with a healthcare professional or registered dietitian before making significant dietary changes.